Okay, so I am doing a presentation on German Shepherd arthritis because my crazy mutt that's running around is part Shepherd, and he does a lot of the characteristics that kind of lead to arthritis. He's very jumpy, he's already kind of got the legs that are kind of stiff a little bit, so we're watching that because he's only 2 years old. So he's definitely a good suspect for arthritis in the future. What is arthritis? So arthritis is a degenerative joint disease, and it deals with painful inflammation and also stiffness of the joints. So who is more susceptible to arthritis? Purebred dogs are generally more susceptible, not always the case. Definitely mutts can get it too. Large breed dogs, obese dogs, and then dogs that put undue stress on their joints, so like excessive jumping. And I do have a video of shadow jumping because my bed is probably about this high on me and he jumps up with no problem every time we go to bed, and I'm really gonna hope that the sound is turned off on this, because if not you're gonna hear, So he clears the bed pretty well. I figured that would actually be a problem when I adopted him, getting up on my bed, because obviously my bed is very tall considering I'm fairly short. I have to use a step stool, but my mom insisted on a, can't think of the word under the mattress, the box spring. Box spring, thank you. Yeah, she insisted on a box spring. So.
I thought you were going to maybe see pee or something.
Oh, no.
There's that film. But here's what you got to do with Shadow, though. You need to make him a platform soon that's halfway up in a four-legged platform with a pretty good surface area.
So instead of the steps, because I've been looking at getting steps for the bed.
Well, you know, steps are kind of narrow, but a platform like, I'm going to say 2x4 piece of plywood that's got 4 legs. Most of the lumber yards will cut things for you.
We have them at home.
And then you got a platform to stop. And then you jump up. Okay.
Oh, we have a dog on the loose. We're good.
Okay.
Okay, so diagnosis. Usually it's during a routine vet appointment. They'll check for stiffness, ask about different behaviors such as excessive jumping, or like if the dog is kind of laying down more, being careful when they lay down, stuff like that. The first step to confirm the severity or just the case of arthritis is x-rays, which you can see in this. This is a normal joint, and then this is after it's kind of degraded a little bit. So that's kind of the difference of it. Unfortunately, once it gets pretty severe, there's only pain managing drugs that really do anything. It's not something that you can reverse once it gets there. Like I said, ways to treat and manage arthritis: regular exercise, weight control, so making sure your dog doesn't eat too much, table scraps in general too. Then resting comfortably, so like lots of blankets, no hard surfaces. So like if you have a crate, definitely have a padding, blankets, all that stuff. There are special diets and supplements that can help with the bones. Just like we can take vitamin D, they can have like a supplement to the same extent, is what I read. And then obviously the pain relief for like the drugs, which there are several medications. Some of the most common are Rimadyl, Duramax, and Novox. So like I said, it's kind of after that, it's just management. And then, so I'm going to talk about one of my first dogs, actually. She was a Shepherd Collie mix, and she was an inside-outside dog, so she spent a lot of time outside running around because she was bigger. We have like over an acre of land. She loved it. She would always she would never go far, and we were always outside with her, obviously. But we were faced with the choice of having to euthanize her when she got up there. She was 12 years old, and she couldn't move her back legs at all. She would just kind of scoot around. And if you actually look at this picture, where's the...
Try the other laser for a minute. Sometimes the switches are bad. Push harder.
Push harder. Oh, there we go. That one's working now. Okay, so if you actually look down here at this picture, that's not her leg. The thing that is held up off the ground is her leg, because she was trying to relieve pressure from the leg and the back hind. That was her first leg that kind of started acting up, and then due to the pressure from obviously holding the other one up, her other hind leg kind of let go as well. Yeah, that's me.
I thought so.
Yeah, that's me when I was 7.
7? Okay.
Yeah.
Wow.
So we just kind of had to like decide, well, she's not really getting around, she's struggling, she's not really living life, and we had to put her down at 12 years old. So she did have a good life, and like we managed the arthritis. We actually had her on Rimadyl for, I believe, 4 years, something like that. So, but unfortunately shepherds are very, very prone to it, and then they're also prone to like hip dysplasia and other things like that, so.
So that object there is her tail then? It looks
Yes,
like, yeah.
correct.
And that's really not a normal position for a tail either.
Mm-mm.
The more under it gets on an animal, that's more stressed, or
Yep.
distressed, or afraid or something.
Yep. So that was all her, and I mean, you can tell in her face that she's still like happy to be petted, happy to be loved, and I mean, there's another picture that was taken like right before this where we're both laying on the ground, but obviously you can't see the leg up,
Right,
so.
right.
But yeah, she just kind of had her own way of dealing with it, and then we had to make the final decision.
Mhm.
And then that's all I have.
Okay, so we got questions, comments. Here's one over here.
Well, my question is more on the Rimadyl that she was on. Normally, they don't have pets on Rimadyl for long, extended periods of time because of all of the ulcers that they can get.
Right.
Does
So now-
she have any issues or
Now
anything
maybe
like that?
She actually.
maybe back then, because that was a few years
Yeah,
ago.
that was a while ago. She didn't have any issues with ulcers. They did take a bunch of x-rays and like a bunch of tests for her to see if she was still like having like the normal amount of blood levels, everything like that. They were doing, I think we had to take her in every 6 months to do a checkup after she got put on Rimadyl, and then they weren't, I don't remember, I was obviously 7, so I don't remember a whole lot of it, but this is all information from my parents, and like, they said she was on Rimadyl for a long time, and then she was fine, so.
Now, are you talking about like gastric ulcers, intestinal ulcers, that kind of thing?
Okay.
Okay. Yeah, and see, that was 10 years, at least 10 years
Yeah.
ago, so maybe the state of knowledge is different now.
And yeah.